The top stories tonight in Y News. 500,000 doses of Sinovac vaccines purchased by the Philippine government arrives in the country.
Workers infected by COVID-19 may now receive compensation from the Employees Compensation Commission program.
Lawmakers distribute Ivermectin drug to the public as COVID-19 cure, despite strong opposition from the Health Department. President Rodrigo Duterte says he would not compromise our sovereign rights in the West Philippine Sea despite owing China a huge debt.
Experts say the Indian government is undercounting its COVID-19 deaths.
And know how the Himalayan kingdom of Bhutan outpaced other rich and big countries by vaccinating nearly all its eligible population. Good evening, Philippines and the world. Today is Thursday, April 29, 2021. I am Herlene Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William T.
First in the news. 500,000 doses of CoronaVac vaccines developed by China's Sinovac Biotech have arrived today via chartered flight of Cebu Pacific. Vaccines Czar Carlito Galvez Jr. welcomed the arrival of the vaccines. This brings the total number of Sinovac vaccines in the country to over 3 million doses, 2.5 million of which are purchased by the government and 1 million doses donated by Chinese government. Galvez says another 1.5 million doses of Sinovac vaccines are expected to arrive on May 7. The country is also expected to get a steady supply of Gamaleya's Sputnik V vaccines next month, starting with the arrival of 15,000 doses that has been delayed due to logistical challenges.
Kaya po nagpapasalamat po kami sa Philippine Airlines at saka sa Cebu Pacific kasi magbo-volunteer po sila na direct flight na po galing sa Moscow. Pwede po natin kunin po, Mr. President. 12 hours lang naman po yun, long haul. So ngayon gumagawa ko ng plano para hindi na po ma-delay.
Galvez adds up to 10 million doses of vaccines from manufacturers Moderna, Sinovac, Gamaleya, AstraZeneca, and Pfizer from the COVAX facility are expected to arrive in June.
By dating ng August, magkakaroon na po tayo ng acceleration na 15 million to 20 million a month. And pagka nagkaroon po na tayo niyan, bubuhos po yung ating mga volumes sa ating mga different highly urbanized area. Ang po natin pagka-once nagkaroon po tayo ng ganyang klase na pagbuhos ng mga volumes, ang ating pong target po is for every week meron po tayong 2 million to 3 million. Meaning ang ating per day is 500,000 to 1 million ang po natin, makakaya po natin.
The government is eyeing to start the vaccination for the A4 priority group comprised of economic frontliners by June and for the general public by August. The government reveals its pandemic response strategy for the coming years. These include the elimination of COVID-19 and the recovery of the economy. Meanwhile, people outside the listed priority groups for the government's COVID-19 vaccination may be inoculated starting August. Rosa Licos reports.
National Task Force Against COVID-19 Chief Implementer and Vaccine Czar Carlito Galvez revealed the government's 3-year plan on COVID-19 pandemic. Eliminating the disease and full economic recovery is eyed in 2022. While this year, the government is concentrating on containing COVID-19 infections by enabling the pandemic response strategy.
Sa 2022, ang po natin elimination ng COVID-19 at saka meron po tayo mga access para sa mga tinatawag natin ng mga boosters, and also magkaroon din po tayo ng tinatawag na social cleaning program to negate the stigma of COVID-19.
Because of the delays of the vaccine deliveries, the vaccination rollout for the general population has been moved from July to August. In August, around 15 to 20 million doses of COVID-19 vaccines are expected to arrive in the country.
Very confident po kami na makukuha po natin na by August, makakaroon po tayo ng general public vaccination.
Currently, 1.56 million health workers, senior citizens, and those with health condition have been vaccinated in the country. We have already received 4.025 million doses of COVID-19 vaccines, including the 525,600 doses of AstraZeneca vaccines from the COVAX facility and the 3.5 million doses of Sinovac vaccines. Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, Metro Manila and neighboring provinces Bulacan, Cavite, Laguna, and Rizal remain under modified enhanced community quarantine or MECQ until May 14, 2021. President Rodrigo Duterte's decision was based on the recommendation of the Interagency Task Force for the Management of Emerging Infectious Diseases, or IATF-EID, and upon the appeal of Department of Health Secretary Francisco Duque III. Other areas under MECQ from May 1 to 31 are Santiago City in Isabela Province and Quirino in Region 2 and Abra in the Cordillera Administrative Region. The more relaxed General Community Quarantine or GCQ will be imposed in Apayao, Baguio City, Benguet, Ifugao, Kalinga, Mountain Province, Cagayan, Isabela, Nueva Vizcaya, Batangas, Quezon, Tacloban City, Iligan City, Davao City, and Lanao del Sur. The rest of the country is placed under the most relaxed quarantine status or the modified GCQ. President Duterte said government interventions are necessary to contain COVID-19 as well as to protect the public against the coronavirus. He also reiterated his advice to the public to continue observing the minimum health public standards amid the pandemic. The Department of Trade and Industry will recommend the gradual opening of some businesses in areas under the modified enhanced community quarantine. JP Nunez will tell us why.
Department of Trade and Industry Secretary Ramon Lopez recommended to the Interagency Task Force against COVID-19 to allow the gradual reopening of personal care services such barbershop and salons at 50% capacity in MECQ areas. The Secretary also recommends reopening of dine-in services at 10% capacity. With this recommendation, the DTI hopes to bring back millions of displaced workers.
Kung matutuloy na maka-open sakaling i-approve ng IETF ngayon sa personal care services and indoor dining, we will have 400,000 doon sa personal care and then another siguro 100,000 doon sa restaurants na madadagdag doon sa dine-in. So maybe mga 500,000, it's just an approximation. Sana Yusek para yung 1 million natin na natitirang nawala or displaced workers makabalik na.
The National Economic Development Authority or NEDA estimates that 30 billion pesos are lost every day to workers with limited business operations due to stricter implementation of quarantine restrictions. The IATF will still decide on the recommendation. Meanwhile, the schedule of mall hours may be extended in NCR Plus areas when the new curfew hours will take effect.
In all likelihood, Yusek, papayagan na kasi LGUs rin naman ang nagsiset ng curfew in their own localities. So kung iakyat nila ng 10 p.m., malamang pati malls natin 10 p.m. rin. Pero syempre depende rin yun sa lugar kasi merong mga local government units rin that can control or that can impose stricter measures, hindi ba? Kung nakikita nila na may violation ang mga tao or nagkukumpul-kumpul dun sa mall, they can, of course, set a stricter regulation on this.
JP Nunez, UNTV News and Rescue. We serve the people. We give glory to God.
The number of COVID-19 cases in the country rose to 1,028,738 with the addition of more than 8,000 new cases. The case bulletin of the Department of Health or DOH showed 8,276 new cases, 6,636 new recoveries, and 114 new deaths. Total recoveries climbed to 942,239, while total deaths rose to 17,145. Of the total number of cases, 69,354 active cases, of which 94.9% were mild, 1.6% were asymptomatic, 1.4% were severe, and 1.1% were critical. The Health Department said all labs were operational on April 27, 2021, while one lab was not able to submit their data to the COVID-19 document repository system. A worker from the private or public sector who contracts COVID-19 virus may now receive compensation from the Employees Compensation Commission program. Ray Pelayo will tell us why.
A worker experiences financial burden when he or she is infected with COVID-19 due to the medical expenses. This is aside from the loss of opportunity to earn.
Kung mauubos na yung inyong service incentive leave at wala ka nang magagamit, malaki yung mawawala sa sahod mo. Dahil ikaw ay naka-confine dahil sa sakit o dahil dito sa coronavirus disease.
These problems will now be solved after the Employees Compensation Commission or ECC includes the COVID-19 on its list of occupational and work-related compensable diseases. Under the ECC Board Resolution number 210414, COVID-19 clinically diagnosed and consistent with the history and signs and symptoms of COVID-19 supported by diagnostic proof to include reverse transcription polymerase chain reaction test is compensable in any of the following conditions. There must be a direct connection between the offending agent or event and the worker based on epidemiological criteria and occupational risk, for example, healthcare workers, screening and contact tracing teams. The task assigned to the worker would require frequent face-to-face and close proximity interaction with the public or with confirmed cases for healthcare workers. Transmission occurred in the workplace or transmission occurred while commuting to and from work.
Kailangan lang po certification sa employer na siya ay nagtatrabaho during that time na nakakuha siya ng COVID. Kaya na-transmit siya dun sa opisina na meron ding mga COVID na positive na mga empleyado.
With this development, a worker from the private or public sector who contracts the virus may avail of 480 pesos daily allowance, hospitalization, and death and burial benefits. Qualified beneficiaries may apply to Social Security System for private employees and GSIS for those working in the government. The beneficiary may also avail of a 10,000 peso cash assistance from the ECC. ECC Executive Director Stella Sipagan Banawis said this development is timely given the current situation in workplaces. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
The COVID-19 death toll in India has crossed the 200,000 mark. However, some officials say the government's death count does not tell the whole story. Ia De Vera gives the details why live. Yes, Ia, good evening. Go ahead.
Good evening, William. As India faces a devastating COVID-19 crisis with oxygen supplies running low and hospitals full of patients, evidence also shows that death toll is way higher than the official report from the government. For the past few weeks, the country has reported more than 300,000 daily cases of COVID-19, and recently an official death toll crossing 200,000 mark. However, several experts and observers are in doubt of the reported official death toll, saying that the actual count may be higher as India is undercounting and underreporting fatalities caused by the pandemic. In Bhopal, a city in central India, officials reported 41 COVID-19 fatalities in mid-April. But a survey of COVID-19 on cremation and and burial grounds conducted by a news agency revealed a total of more than 1,000 deaths during the same period. Also, a worker at a large cremation grounds in Ahmedabad in the western Indian state of Gujarat said he had never seen a never-ending line of death and was instructed not to write COVID-19 as cause of death. Bramar Mukherjee, an epidemiologist at the University of Michigan who has been following India's COVID-19 closely, says that this is a complete massacre of data. She believes that the true number of India's COVID-19 death is 2 to 5 times what is being reported. Dr. G.C. Gautam, a cardiologist based in Bhopal, said that many deaths are not getting recorded and officials were doing this because they don't want to create panic. As of today, report shows India has 18,376,421 COVID-19 cases and 204,832 fatalities. William?
Yes, thank you, Iya De Vera, for that report live from New Zealand. Meanwhile, Filipinos in India were included on the temporary ban to enter the Philippines in compliance with the travel ban approved by the government. The Bureau of Immigration also imposed a strict implementation of passport inspection for foreign travelers. Marvin Callas reports.
Although the double mutant strain of COVID-19 found in India is considered as a variant under investigation, the Department of Health decided to include Filipinos in India on the implementation of travel ban. It aims to prevent the entry of other variants in the country.
Nakita natin talaga na ang bilis ng pagtaas bigla ng kaso with the existing variants that they have. No matter ano yung sinabi ng variant, mas transmissible, mas nakaka-apekto sa katawan ng tao, kailangan lang natin ipatupad kung ano man ang ginagawa na natin ngayon dito sa ating bansa.
The Bureau of Immigration, on the other hand, intensifies its implementation of passport inspection for travelers arriving in the country. This means that no one gets through the Philippine Airlines, especially those that came from India and those having a 14-day travel history from the same.
Instruction po sa ating mga frontline personnel is 100% passport inspection para po ma-determine ang travel history ng isang arriving person. Lahat po ng kanyang biyahe nitong huling 14 days ay bubusisiin po ng ating mga immigration officers. At kung makita po natin na meron po siyang biyahe galing po sa India within the last 14 days, siya po ay i-exclude po natin, isasakay po siya sa next available flight back sa kanyang port na pinanggalingan.
BI assures a total ban and that there are no exceptions for travelers coming from India.
Sa mga nanggagaling sa India, actually po wala na po talaga tayong ine-expect na makakarating dito galing po sa bansang iyan dahil very specific po yung nakalagay dun sa IATF resolution, giving the airlines the responsibility na hindi na po i-board yung mga passengers na nanggagaling po dyan sa region na iyan para hindi na po sila makarating dito po sa Pilipinas.
Travelers with official business, including Filipinos, planning to return to the Philippines were advised by the Bureau of Immigration to check and follow implementing protocols before traveling to avoid possible delays. For more information and policy updates, visit the immigration website at www.immigration.gov.ph. Marvin Callas, UNTV, News and Rescue. We serve the people, we give glory to God.
Two lawmakers proceeded with the distribution of the anti-parasitic drug Ivermectin to public, defying warnings on the drug. Asher Cadapan Jr. tells us why live. Asher?
Santiago Congressman Mike Defensor and Deputy Speaker Rodante Marcoleta explained that they are ready to face the consequences if there are any violation in their distribution of ivermectin as a medicine against COVID-19. This is while the Department of Health opposes the use of ivermectin for treatment of COVID-19 patients. They explained that doctors prescribing its intake know what they are doing.
So ang ginagawa natin, pantulong sa tao, bunsod ng nakita namin na pagpapatotoo at pagpapatunay ng napakaraming doktor. Nakita nyo naman lumabas ang doktor nasa publiko. Hindi nila siguro isasakripisyo sa sarili nilang lisensya. at ang kanilang karangalan at pangalan.
Lahat naman yan, hindi naman yan sinasabing yan na yung gamot dahil wala pang gamot sa COVID-19. So I think it has to be fair that Ivermectin is treated the same way. So yun din ang tanong ko sa kanila, pag nagbigay sila ng gamot, sinong responsable?
More than 30 residents of Barangay Matandang, Balara, Quezon City received 10 compounded Ivermectin capsules. Meanwhile, residents who received the prescribed medicine said they have volunteered to take Ivermectin and understand the side effects that they may experience.
Kusa naman akong umuo na nag-ano ng gamot na yun. So wala akong sisihin kung ano man mangyari sa akin.
Since na wala pa tayong enough vaccine, prevention is better than cure, sabi nga nila. So wala naman masama itatry. Mild lang naman daw yung side effects nito.
Meanwhile, concerned doctors and citizens of the Philippines, President Dr. Benigno Igi Agbayani explains that they may use any prescription pad as long as their name, signature, and license number is indicated.
Ang prescription pad kasi, actually, ano lang naman yan eh. It should be in the proper form. May date, may pangalan. Hindi naman kailangan, hindi naman yan parang cheque. Hindi naman parang cheque yan. And malino naman sa pasyente na doktor yung kausap. So yun naman importante.
The DOH has yet to release any statement regarding the matter. Diego?
Thank you, Asher Carapan Jr. reporting live. The Quezon City Health Department is urging the Department of Health and the Food and Drug Administration to issue a clear stand on the safety and general use of anti-parasitic drug Ivermectin. The City Health Department pointed out that a firm stand by the national regulatory agencies will help to set the record straight, explaining the legality and efficacy of the drug, including its distribution to the general public. The Quezon City local government continues to stand by the science-backed recommendation that a vaccine is still the safe and effective way to protect the people against COVID-19, along with strict compliance to minimum public health standards. An infectious disease expert explains that there is no drug available yet in the market that can cure COVID-19. Although the U.S. Food and Drug Administration has approved the use of remdesivir, experts in the country are only recommending this to patients who need oxygen support. Meanwhile, pharmaceutical giant Pfizer says a take-home pill against COVID-19 could be available before the year ends. Aiko Miguel has this story.
Ivermectin, remdesivir, and other drugs used for clinical trials are considered as investigational drugs against COVID-19 in different parts of the world. According to Philippine Society for Microbiology and Infectious Diseases President Dr. Marisa Alejandria, there is no miracle drug yet against COVID-19 infection. Ivermectin, as distributed by some congressmen, still not considered effective against COVID-19.
Ivermectin is just one drug. There are other drugs that we have reviewed. There are already drugs that have been tried in big trials. So the management of COVID-19 is not like one drug will kill the COVID-19 virus. So we all know that there are different stages. So we have the asymptomatic, mild, moderate, severe, critical. So for each of these stages, we have different sets of interventions that we need to give to our patient.
According to Department of Science and Technology Philippine Council for Health Research and Development Executive Director Jaime Montoya, the public has to understand that a supplement is different from a drug. Supplements being studied by DOST like virgin coconut oil and melatonin support the immune system of an individual, but it can't be concluded that these are already cure for COVID-19.
Pwede nang inumin, but wag lang po tayo aasa na just because uminom tayo noon, siguradong gagaling tayo may COVID-19 at pinag-aaralan pa po yan.
Meanwhile, although Ebola virus drug remdesivir is already approved in the United States for COVID-19 treatment, according to Dr. Alejandria, this is not yet proven to cure COVID-19. In the country, it is only recommended for those who need oxygen support.
Our assessment is we do not recommend it. We suggest against the use of remdesivir for patients who do not require oxygen. So dun sa mild and moderate, hindi siya recommended. So we did not see any benefit in reducing mortality. So we suggest the use of remdesivir among patients requiring oxygen supplementation, but not those who are already in the critical stage. Yung sa naka-mechanical ventilation, wala na rin nakitang benefit here in that group of patients.
Meanwhile, a COVID-19 take-home pill is undergoing clinical trials in the United States. According to Pfizer, it can be prescribed at the first signs of illness, and it can be combined with other classes of antivirals to battle COVID. Pfizer says their antiviral pill for COVID-19 may be ready for authorization by the end of this year.
Pag may bago naman, di ba, all of us would always want, no, na makaka-access tayo sa ganito para sa ating mga kababayan. So kailangan natin antayin hanggang makakumpleto sila, and if this will really provide evidence na talagang it's effective, and then by all means, no, the Philippines will access these drugs for our population.
According to the DOH and Food and Drug Administration, any newly discovered drug or vaccine against COVID-19 has to be registered in the country, evaluated, and be approved first before making it available for Filipinos. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
President Rodrigo Duterte admits that the country owes China a huge debt due to the vaccines donated for the Philippines. However, the president stressed that he cannot compromise the country's sovereignty in the West Philippine Sea. Nel Maribohok will tell us why.
President Rodrigo Duterte asserted that the Philippines will not go to war with China. This is amid the tensions in the West Philippine Sea. According to the president, the country owes China a huge debt because of the COVID19 vaccines donations.
Kaya ako sabi ko, I'm stating it for the record, we do not want war with China. China is a good friend. Mayroon tayong utang na loob na marami, pati yung bakuna natin.
But despite this, the president will not compromise the country's sovereignty, particularly in the West Philippine Sea.
Pero sabihin ko na there are some things in life which cannot be bargained for. And this is one of them.
The president has also no plan to just recall the vessels of the Philippines patrolling in the West Philippine Sea.
Ako, kung paalisin tayo ng ganun lang, umalis kayo. Huwag kayong umalis. Bakit kayo umalis dyan? Atin yan eh. So, China must understand.
This is the response of President Duterte after China's Foreign Ministry spokesperson Wang Wenbin said that the Philippines should stop actions complicating the situation and escalating disputes. According to the Bureau of Fisheries and Aquatic Resources, or BIFAR, the West Philippine Sea has a very important role to Filipino fisher folks as well as the country's fisheries production.
At dapat din po nating tandaan na ang West Philippine Sea, about 7% of the total fisheries production annually ng Pilipinas ay nanggagaling po doon sa West Philippine Sea. At more than 300,000 metric tons ng isda po ang nakukuha natin sa West Philippine Sea.
BIFAR also assures the support of the government to the Filipino fishermen in the West Philippine Sea. Nel Maribohok, UNTV News and Rescue. We serve the people, we give glory to God.
The Bureau of Fisheries and Aquatic Resources, or BIFAR, is encouraging Filipinos to catch fish in the West Philippine Sea. The BIFAR assures the security of our local fishermen. Leia Ilagan has the story.
The West Philippine Sea can produce 324,000 metric tons of fish for the country annually. Bureau of Fisheries and Aquatic Resources, or BIFAR Director Eduardo Gongona says the West Philippine Sea is rich in fishes such as different types of mackerel, round scad, sardines, and other expensive fish.
Nakakatulong sa ating food security kasi hindi nababawasan, kung dapat lang madagdagan pa yung
yung ating ample share na dapat na makuha natin dyan, di ba?
Gongona adds, if the supply of fish in the country increases, the price certainly will be cheaper.
Relatively speaking, no, talagang pag dumami yung supply natin, bababa yung presyo, di ba? Supply and demand yun. Kaya nga, kailangan yung supply na nanggaling sa West Philippine Sea, hindi makulang, no?
BIFAR also want to ensure the safety of the Filipino fishermen with the help of the government troops patrolling the disputed waters.
Habang nandun yung ating mga mangingisda, kailangan naman bigyan natin sila ng kaukulang pansin, no? Kaukulang protection in essence na ang feeling nila, we protect the fisherman, we protect the fishing vessel, and we protect the environment.
The country has currently 300,000 fishermen and only over 100,000 go to the West Philippine Sea. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
Communities are now setting up their own food pantries with different themes or styles, but for a unified cause to help others in need. Janice Inhente has the story.
Who would have think that street foods could also be a good idea to feed our fellow men who are in need in this time of pandemic? This concept was the idea of the group Ambagan PH. The group had their community pantry at Barangay Concepcion 1 in Marikina City, giving vegetables and other food products. But as they ran out of supplies, they decided to have a unique partnership with a fishbowl vendor to give free snacks to street sweepers and other workers.
Napansin namin na marami sa mga pupunta, lalo na pag mag-aalas 12 na, nagugutom na po yan. Yung mga binibigay naman po natin karamihan sa pantry, mga gulay, mga kailangang lutuin. Yung mga nasa kalsada po, lalo na yung mga homeless, karamihan dyan, mga hindi naman, walang kakayahan na magluto. So naisip natin, bakit hindi tayo mamigay ng something na pwedeng agad-agad kainin nung mga taong dumadaan.
Fishbowl vendor Hil Samonte did not hesitate to join the good cause.
Malapit sila sa amin doon sa yung pantry. Sinabi ko, ano po ba ang matutulong din ng katulad kong isang vendor na fishbowl? Napakyaw nila, tapos pinimigay, nakakatulong din kami sa mga tao na nagugutom, saka sa mga street sweeper, mga magbobote. Nag-ano nila ako ng palamig para kahit papaano, tapos kumain, may mainom. Sana kahit yung sa mga vendor, sana makatulong tayo kahit sa maliit na bagay. Hindi naman lahat ng tao mapipera, kahit na mahirap, sa ganito paraan makakatulong.
Meanwhile, buko juice vendor Marlon Monterona is also happy to share his products for free.
Medyo mahirap po. Talagang todo kayo dyan para kumita lang. Kasi mas malakas ang bintahan namin nung hindi pandemic. Ngayon mahina Masaya na nakatulong ako, nakainom sila ng medyo malamig at saka buko juice yun. Magbibigay pa rin po ako ng ganun. Tutulong pa rin ako sa kapwa ko, vendor. Tsaka sa mga taong mahihirap na yung walang maibili, pwede rin naman ako magbigay.
Despite the vendors' stature of life, they are still willing to help and share the love to others who are in need. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
Justice Secretary Menardo Guevara shared his views in the recent red tagging of government officials and the anti-terror law, with both finding a possible link. Dante Amento tells us why.
The Anti-Terrorism Act might have encouraged some officials in the security sector to exploit certain individuals or groups as supporters of communist groups. Justice Secretary Menardo Guevara says though he does not want to speculate, but there is a reason to believe that there is a possible link between the two. Guevara explains that Republic Act 1700 or the Anti-Subversion Law, which outlawed the Communist Party of the Philippines, was repealed in 1992. This allowed new members to join the communist group without much fear. But under the new Anti-Terror Act, recruitment and membership of the terrorist groups such as the CPP, NPA, and DF will be punished. And it is fair to say that the law has a relation with the current red tagging activities. Former Bayan Muna Party List Representative Nery Colmenares, counsel for the anti-terror law petitioner, affirms Guevara's position. In fact, he was allegedly red tagged by Solicitor General Jose Calida during the oral arguments against the law last Tuesday.
Ilang beses na naming TRO, yung aming reiteration or the issuance of the TRO. Sinasite namin ng red tagging, yung malala, your honors, na pag-TRO na muna itong terror law para hindi na lumalas itong mga hulihan, mga patayan at mga red tagging.
The National Union of People's Lawyers or NUPL, petitioner of the law, believes red tagging is one of the adverse effects of the Anti-Terrorism Act.
Binigyan talaga ng batas in a way na bigyan ng legal basis ang red tagging through the process of designation. So they can always tag anybody, this time saying that they are terrorists.
Meanwhile, the DOJ supports the enactment of a law which aims to criminalize red tagging, which provides legal remedy to the aggrieved individuals. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
And for the news abroad, the Hong Kong government has passed a new bill that has the ability to limit bar immigration to and from the city. Maven Dog tells us the details live. Yes, Maeve, good evening.
Marielle, the new bill garnered 39 votes for and 2 votes against. Concerns have been raised regarding this new law, as many believe this as an adoption of exit bans used to control the international business hub as they do in mainland China. Exit bans in mainland China are put against activists who oppose the government, and many are worrisome if this were to be in application. This is seen as a violation against human rights acts, as freedom of movement is being restricted, said by the Hong Kong Bar Association member Cho Hang Tung. The new bill specifically detailing the provision which gives power to the immigration chief of Hong Kong to stop individuals from boarding planes have agitated businessmen, lawyers, and activists. The Security Bureau reassures and states that the new bill only impacts the flights headed towards Hong Kong. However, legal analysts reveal that it can potentially affect flights leaving the city. Many have negatively commented on the new bill, criticizing it as another excuse to deport refugees, people who were not wholly supported in the city. Marielle?
All right, thank you, Maven Dog, reporting live from Queensland, Australia. Scientists has discovered that the melting speed of the world's glaciers has nearly doubled in over the past 20 years. Marvy Delfin will give us the details live. Yes, Marvy, please go ahead.
Marielle, in a study published on Wednesday in the science journal Nature, scientists say their findings have painted an alarming picture as nearly all of the world's 220,000 glaciers are losing mass. This is the most comprehensive international research of ice rivers ever undertaken, and experts say human-driven global heating is behind this phenomenon, which has seen overall sea levels rise by 21%. High-resolution imagery from NASA's Terra satellite from 2000 to 2019 revealed that glaciers have shed an average of 267 gigatons of ice per year. The mass loss was equivalent to submerging the surface of England under 2 meters every year. This rapid melting can cause deadly outbursts from glacial lakes in places like India. Lead author Romain Huguenet says that this data was an urgent warning and calls on policymakers to design adaptive strategies for the more than 200 million who live in coastal areas threatened by rising sea levels before the end of the century. While Samuel Nussbaumer of the World Glacier Monitoring Service was not directly involved in the latest assessment, but he confirmed the trends observed through many decades of ground monitoring and satellites. Scientists note that it could take decades or centuries for glacial ice to regrow once they melt. Back to you, Marielle.
Thank you, Marvin, for those updates live from Australia. The Malaysian government has decided to remove the AstraZeneca vaccine from its main pool of COVID-19 vaccine. Maya Perquez will tell us.
Following reports of blood clots in those vaccinated in several European countries, the British-Swedish vaccine AstraZeneca would be excluded from the Malaysia's vaccination program. Mr. Khairi Jamaluddin, the coordinating minister for immunization, considered that scientific data regarding the efficacy and benefits of the vaccine has added to the reluctance of the public to get vaccinated due to the perceived risk. The National Immunization Plan, which started at the end of February and now at the second phase for high-risk groups, will only use the Pfizer, BioNTech, and Sinovac vaccine. Vaccine registration program has been moving slowly, with only 1% of the total targeted 80% of the population were added for the past week. Currently, only 9.3 million has registered out of the 24 million target. Over 2,000 daily infections have been recorded since April 15, with active cases to over 25,000 on Tuesday. COVID-19 restrictions has been extended for a fourth month until after the Hari Raya or Muslim New Year celebrations next month. Maya Berkes, UNTV News and Rescue, Malaysia. We serve the people, we give glory to God.
Meanwhile, athletes of the Tokyo 2020 Olympics and Paralympics will be tested for COVID-19 daily as part of coronavirus countermeasures set to be in operation at the Games. Tokyo 2020, the International Olympic Committee and International Paralympic Committee unveiled the second version of the playbook for athletes and officials, which outlined the rules participants at the Games must adhere to. Its release comes amid rising concern over the fate of the Games in recent weeks, following a surge in COVID-19 infections in Japan and other countries, including India and Brazil. The Himalayan Kingdom of Bhutan has vaccinated almost all of its eligible population in less than 2 weeks. RK Lorca will give us the details live. Yes, RK, good evening.
Yes, Mariel, good evening. The Himalayan nation, Bhutan, has given almost all of its eligible population a vaccine shot, where some villages were reached by a helicopter and health workers hike through ice and snow. One remote area in Bhutan, Lunana, covers an area about twice the size of New York City, with glacial lakes and some of the world's highest peaks, and is inaccessible by car. Still, most people living there have already received the coronavirus vaccine. Vials of the Oxford AstraZeneca vaccine arrived last month and was distributed to more than 1,200 sites across the country using cold chain storage. Nearly 3,300 health workers and 4,400 citizen volunteers, known as the SOOPs, were deployed across the country to help with the rollout, the health ministry said. Ranging the country's vaccination rate of 63 doses per 100 people was the sixth highest in the world and nearly 6 times the global average, which was ahead of those of Britain and the United States. Bhutan's health minister, Dasho Deshen Wangmo, attributed its success to leadership and guidance from the king's public solidarity. She also added that the general absence of vaccine hesitancy and a primary healthcare system that enabled them to take health services even in the most remote parts of the country have added to the country's vaccine thriving success. Back to you, Mariel.
Thank you, RK Lorca, reporting live from Bangkok, Thailand. And those are the reasons behind the news in other parts of the globe. I am Mariela Toza, live from Perth, Australia. Good evening.
The Armed Forces of the Philippines continues to provide free food through its mobile kitchen. Today, the soldiers provided hot meals to pandemic-hit residents in Quezon City. Denise Inhente has the story.
More than 1,500 families in Barangay Socorro in Quezon City have been provided free food from the Armed Forces of the Philippines Mobile Kitchen. 3,000 food bags were distributed to the residents near the camp who are mostly low-income earners.
Sabi nila, ikutin nyo, pasukin nyo yung mga loob-looban. And true enough, nung pinasok namin, tinignan namin yung mga maraming mga bahay ng street sweepers, ng mga tricycle driver, pedicab driver, and when we coordinated with the barangay officials, sabi nila, sir, marami talagang nagugutom din dito sa paligid lang ng Camp Aguinaldo.
Irma Balmadres, one of the beneficiaries, is thankful for the initiative. After her husband lost his job due to the pandemic, the couple is struggling to feed their 8 children.
Kung may bigay po ng mga kabarangay natin, pinagkakasa na lang po. Maganda naman po ma'am kasi nakasurvive po kami sa tanghalian, lalo na po yung mga bata. Nakatikim po kahit paano yung mga anak po ng masarap po na pagkain, kahit ngayon lang po. Salamat po sa pinanggalingan ng pagkain natin.
A senior citizen, Belenda Castillo, is also one of the recipients.
Alam-ula ko, isasaing tong araw na ito, magpila sana ako doon sa 7. Ang haba naman, ng buong bumalik ako. Nagbigay naman ng 3 kami sa bahay. Okay lang, maraming pasalamat na nakatikim kami ng manok.
The barangay captain was thankful for the help provided by the soldiers in their area.
Itong maliit na bagay na activity na to, yung pagkain, ang pinaka-importante. Lahat po ng tulong, welcome po sa lahat ng ating mamamayan. Kaya po maraming salamat sa AFP at sa ganitong community activity nila.
The AFP plans to bring their mobile kitchen to more residents in need. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news, April 29, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.